Now, COVID-19 has claimed the life of one of our own here at eMedia. Our colleague and friend Lungile Tom died in hospital this morning. He was admitted on Sunday night with COVID-19 related symptoms. His test results confirmed last night that he had COVID-19. Now, he passed away today, and the entire Cape Town Newsroom has been shut down. Our colleagues are in isolation. And to talk about Lungile, I'm joined by ETV's Head of News and Sport, Nuruniesa, Allie. Nisa, you, I know, are also in isolation. You hired this extraordinary cameraman who has passed away. Tell us about him.
Sally, I've been thinking about over the past few hours how Lungile was catapulted into our life. It was about 7 years ago. I was the Cape Town News editor for eNCA at the time. And we had a vacancy in our camera department, and he had applied for the position. I remember sitting across the table from him and seeing this larger-than-life character. And within a few moments, I realized that this was a man who carried his heart on his sleeve. He believed in being kind. He believed in being respectful. And he loved his craft. We instantly knew that this was the right fit for our organization. And over the years, I have been very privileged to be able to see Lungile bloom in his position. He, in the office, that larger-than-life character continued. He was the fist-pumping guy. He was the person who, if he saw that you looked a bit down on the day, he would come and he would ask you, is everything okay? He was extremely loyal to the people who he cared about. He was constantly on WhatsApp, sometimes just sending you a joke to remind you that he was there. New Year's Eve, you would always get a message from Lungile. And I have been so touched to read some of the many tributes that have been posted on social media, people that have contacted us. Some of his colleagues, there was a video of him dancing. Lungile loved to dance. He loved documenting. Beside being a camera person and documenting stories, he documented every single moment of his life. You'd go onto WhatsApp to the status updates, and you'd see what Lungile had been up to on the day. He had visited a colleague in a hospital and had taken a photograph. So the event didn't happen unless he had taken a photograph. Somebody else had written how at Parliament, where he'd become quite a force and a familiar face, he was very pedantic about the reporters going on air and looking good. He loved being in that space. He spoke to politicians. He spoke to police officers who were based there. Mm-hmm. He liked a muffin and a coffee for breakfast. Never asked for it, but his friends would know that that's what he liked. And, you know, he was just, he embodied that warm person, that kind individual every single day.
And Nisa, not just someone who was passionate about television and camera work, but as you say, just a wonderful, wonderful man to be around and to work with. He got sick so quickly. Last Thursday morning, he reported for work. His temperature levels were fine. By Thursday evening, he was getting very, very sick. He was only 45 years old. How did this come on so quickly? Talk us through his last days.
So I'd actually seen Lungile in the office last week. He was setting up to do some shots in one of our corridors, and I greeted him, and he greeted, and he was fine. We've obviously adopted protocols in our office in line with government regulations that temperatures are taken and that people need to report if they're not feeling well. On Wednesday and Thursday, he didn't report anything during the course of the day. On Thursday night, he contacted his line manager and said that he wasn't feeling well, that he would go to the doctor on Friday, and that he would advise as to what the doctor said. Over the weekend, Sally, his condition deteriorated, and by Sunday night, he was rushed to hospital by ambulance. On his admission, staff tested him for COVID-19. His symptoms seemed to be in line with that. And by Monday, he had been admitted into the ICU. The test results came back in the late hours of last night, confirming that he did in fact have COVID-19. And sadly and devastatingly, early this morning, we got news that he had passed away.
It's just so sudden and so shocking and so desperately sad. And our hearts really go out to you. This has had a big impact, and this is something that I'm presuming many companies across South Africa are going to have to come to terms with very sadly in the months to come, is when a colleague gets very sick or a colleague dies with COVID-19. The entire eMedia newsroom in Cape Town has had to go into self-isolation. That's some 70+ people. You are among them. Just tell us about what has to happen now in terms of the functioning of the newsroom, because I think this is important stuff for companies as they consider opening up to really understand the implications of.
So as a company, Sally, we have kept abreast of all of the regulations. We have made contact with the Department of Health as well as the Department of Labour. Tonight, the entire building is undergoing a deep clean, and only once the officials are satisfied with that process will we be issued with a certificate to allow people back into the building. We've undergone a track and tracing process, and that is basically identifying every member of staff who had direct contact with him, and so they have gone to be tested. And for the rest of us, because we operate on an open floor, in an open floor space, the rest of us are in 14 days of self-isolation from the last time that Lungile had been in the office. If I may, Sally, we are doing everything. It's an extraordinary time for our company, for many companies around South Africa, and all of our attention and effort is going into our staff and ensuring that they continue to be safe and to abide by government regulations. But we've also given as much attention to his wife, Nandipa, and their children. And I think that if I could conclude, you know, we've spoken about the memories that we've had internally, but it's so special when we hear from people outside of our circle who speak about his character. And I got an email today from the Parliamentary Press Gallery Association, and I'd like to just read a few lines from that email. It says, while his work was mainly behind the camera, Lungile was known to have a wry sense of humor and to be an acute observer of people and events. Every now and then he would express his thoughts, and when he did, the journalist within earshot would take note. By doing this, he had an indirect and yet more profound influence on reporting from the precinct than probably he or his colleagues ever truly realized. There's an old West African saying that goes, tread softly and carry a big stick and you will go far. This could be altered for Lungile to read, tread softly, carry a big lens, and you will see far.
What a beautiful tribute. And Nisa, I know it's been a very difficult conversation for you to have this evening. Our thoughts are with his family, but also to our family, particularly in Cape Town, where I know everyone is absolutely gutted and devastated. And we just wish you strength at this difficult time. Thank you very much for joining us this evening. That is Nisa Allie telling us about the death at 45 years of age of much-loved cameraman Lungile Tom, who died of COVID-19.